Sri Naveen and Dr. Sharma, dignitaries on dais and friends. As told by the coordinator, I am Dr. Pareek. I am here at Mahavir Cancer Hospital. This is my second inning. I have finished one innings for 37 years in armed forces, and then I retired after commanding Command Hospital now. Since a lot of people from the corporate sector are talking on the hospital infrastructure and they are keen to make it, I as a user would like to discuss and address the issue of the doctors. What are the challenges which we face when we take over these buildings? Why? Why is the hospital challenge? If somebody can make a house, if somebody can make a hotel, why can't he make a hospital? Because there are two characteristics of the hospitals, and these are also not stationary, these are changing day by day. Today, an hospital is a complex building because there are constant evolution in the medical science. We started with the specialists, then super specialists, and now there are standalone centers like cardiothoracic and vascular centers or onco centers or joint replacement centers. So these buildings are specific and there are various stakeholders into that. So when these people, when they plan the building, what is that we look into this and what is that is a requirement and association of the medical fraternity with these buildings is that primarily it is the patient care which is the most important. So therefore, the building has to be patient friendly. In addition to that, every hospital have to have an education and training wing. You have to care for the patient safety and infection control. Quality and safety are the essence of the hospitals, and if these things are not looked into, there is going to be catastrophe. In addition to that, there are certain logistic services and the catering services, laundry services, and the support services in the hospital. Each one of them have its specific needs and specific requirements. There are distinct perspectives of each user in the hospital. Look at the doctors. They would like to have a new clinical demands, that's the evolution. As the medical technology is advancing and we are now switching over to even to the robotic surgeries. Then there is a patient empowerment. Gone are the days. I reflect my medical college days when a doctor used to sit in his garage and people used to wait outside on the ground. It evolved from that stage to a glass-framed garage with some benches outside, to a nursing home, to a hospital, and now hotelier. When we talk of medical tourism, I am going through the program, I understand people have deliberated on that. Now the patient looks into all his needs. And then there are the builder's perspective. What he needs is an architectural design and the engineering needs, which are also essential, like water and the location where the hospital has to be located. Evolution is taking place in the hospital industry and these infrastructures. The concept is now evolving towards the turnkey projects in the hospital and in the advanced equipment stage. Like if you acquire a CT scan or MRI or PET CT, the company itself is asked to design the building for that as per the needs. So it can be taken as a turnkey project where you just turn the key and start working on that. Another factors which are coming is into the need of the family. It is well known thought that a patient finds more healing touch when he is with his families, but at the same time you have to take in consideration into the infection control. So therefore you have to design a building in such a way that the family can be also nearby. After all, everything involved, it has to be cost-effective and efficient building also. Therefore, there are also debates on whether to go on the horizontal building, which has its advantage as every department is adjacent to each other, or the vertical building where you can utilize more space as the space is most concentrated. Another concept which is prevalent is whether to have a single healthcare building or a healthcare facility complex where you need to have quarters and rooms and other education facilities. You make it complex. There is a hospital, there is a school, there are doctors' quarters, there are nurses' quarters, and all the facilities and amenities there. So these are the challenges I would tell to my trade friends who are very keen and ready to come into the hospital building business. Modular concept in the operation theatre is another advanced concept. All these subjects are the very detailed subject in itself, but I just want to highlight for sensitization purpose. Aesthetics is another concept, and green building is another concept where you can save a lot of energy because the hospital requires almost 100% air conditioning, and your building has to be planned in such a way that you can save the energy. Therefore, when you plan a hospital, what do you look into? You look into patient's requirement, you look into staff need, education and training, future development, equipment acquisition, technology advancement, and the requirement of the society. So these are some of the challenges which in 21st century the health care providers and the hospital constructors are looked into.